Good morning. Myself Crazy Rehana working as a nursing tutor in Knowledge Institute of Nursing, Bangalore. So today in obstructive defects, we will learn about co-erectation of aorta. So in heart, we all know that aorta is one of the major blood vessel that supplies oxygenated blood to our all body organs. So today this condition is related to aorta only. So we will learn about the coarctation of aorta. So definition is it is defined as narrowing of aortic arc at the site of ductus arteriosus which causes more pressure to head and upper extremities and lower pressure to lower extremities and body. So what is coarctation of aorta? So first ductus arteriosus. So we will first know that what is ductus arteriosus. So ductus arteriosus, it is an opening that is present between aorta and pulmonary artery. Okay, so this opening is present during fetal life, but after the birth of these fetus, so this opening gets closed. But if it is not closed, then it is called as ductus arteriosus. So this condition is related to ductus arteriosus. So coarctation of aorta, in this the narrowing is present at the site of ductus arteriosus. So because of this narrowing, there will be more pressure to head and upper extremities, and there will be low pressure at the lower extremities and body. Okay, we will learn that why there is more pressure to head and why there is low pressure to the lower body. Okay, this is the picture of coarctation of aorta. So we can see that at the site of ductus arteriosus narrowing is present. So that narrowing is called as coarctation of aorta. Okay, now causes of coarctation of aorta. So there are three causes. The first is genetic factors, then chromosomal factors and environmental factors. So this coarctation of aorta can be from the heredity, then it can be through environmental factors. That is, if mother is consuming alcohol or doing smoking during pregnancy period, or if mother is consuming some drugs like thalidomide, so this will lead to teratogenic effects on the fetus. So these are the causes of coarctation of aorta. Now pathophysiology. So narrowing part of the aorta is called as coarctation. So as we have learned in definition, so whatever the part which has got narrowed, so that part of aorta is called as coarctation. It can be preductal or postductal. So these are the two types of coarctation. So this coarctation can be preductal or postductal. In preductal COA, that is coarctation of aorta, the lower half of the body is supplied blood by the left ventricle through the ductus arteriosus. Okay, we all know that aorta gets the blood from the left ventricle. Okay, so left ventricle of the heart supplies oxygenated blood to the aorta, and from aorta the blood is distributed to all body parts. But in preductal COA, the lower half of the body is supplied blood by the left ventricle through this part. Okay, see, this is the picture of postductal and preductal. So if the narrowing is present below the ductus arteriosus, then it is called as preductal. So these are the two pictures of preductal and postductal. So in postductal COA, left ventricle outflow cannot maintain blood flow to descending aorta in sufficient amount. Okay, in postductal COA, what happens? Descending aorta doesn't get blood. Okay, see in this picture. Here narrowing is present. Okay, here. So the blood narrowing is present, so upper body parts will get the blood, oxygenated blood through this brachiocephalic artery, left subclavian artery, because these three arteries are supplying blood to the upper body parts, while descending aorta is supplying blood to lower body parts. But in our condition, that is coarctation of aorta, narrowing is present here. Okay, that is in postductal location. So because of this descending aorta will not get enough oxygenated blood. So because of this reason only, there is more pressure at the upper body parts and there is low pressure at the lower body parts, because all the blood of descending aorta also will go into the upper body parts. So more pressure we will find at upper bodies, upper extremities. Okay, then next is Narrowing part of the aorta causes obstruction to the oxygenated blood flow to descending aorta, a lower part of the body. Okay, so because of the narrowing part of the aorta, there will be obstruction. Okay, the lower body part will not get enough oxygenated blood. This causes various symptoms like increased pressure on upper part of the body and decreased pressure on lower part of the body. As I told before, that because of this coarctation of aorta, there will be more pressure on upper body parts and there will be low pressure, that is decreased pressure on lower part of the body. Okay, now we will see clinical manifestation. So first is high blood pressure and bounding pulse at upper arm. So as we have seen that there is more pressure on the upper extremities and upper body parts. So when we are checking the pulse, okay, of the upper arms, that is upper extremities. So at that time the pulse will be bounding. There will be bounding pulse will be present and the pressure will also be high. Then we can absence femoral pulse. So femoral, it is at the pulse that we are locating at the thigh. Okay, so at that location we will feel weak pulse, either there will be no pulse. Then lower blood pressure and cold extremities at the lower body part. Then infant may develop CHF, that is cardiac congestive heart failure, acidosis and tachypnea. Then in older children there will be headache, epistaxis, fatigue, then dizziness, weakness, and fainting. So these are all the symptoms that will be present in older children. Then other symptoms are poor weight gain and sweating. So this will be present in the child who is having coarctation of aorta. Then diagnostic tests are history taking, physical examination, chest X-ray, ECG, echocardiogram, cardiac catheterization, and angiography. Now we will see management of coarctation of aorta. So complications like systemic hypertension should be treated with IV fluids and antibiotics. So if the child is having complication like systemic hypertension, so we have to treat it with the IV fluids, otherwise we can also use antibiotics. Then surgical management is resection of coarcted portion with an end-to-end anastomosis of aorta. So in surgical management, what they are doing, surgeon will resect, okay, whatever the part that has got narrowed. So that part the surgeon will resect it, and then the open part that the surgeon will join it with end-to-end anastomosis of aorta. Then enlargement of the narrowed section using graft of prosthetic material or portion of less subclavicular artery. So surgeon can also use the prosthetic material. So with the help of prosthetic material, the part that has got narrowed is enlarged. These defects are present at outside of the heart and pericardium. So cardiopulmonary bypass is not needed. Here we perform thoracotomy. Okay, so we have seen that this defect is not present in the heart. Okay, it is present in the aorta, that is at the ductus arteriosus side. So as it is present outside, so cardiopulmonary bypass is not needed. Here we surgeon will go for thoracotomy. So what is thoracotomy? It is a surgery to open the chest. Okay, so during this procedure, surgeon will make an incision in the chest wall between your ribs, and then the surgeon will operate it. Then balloon valvuloplasty is the first choice of procedure. So this surgery are performed at 3 to 5 years of age. So see in this picture, this is the picture of end-to-end anastomosis. So in first we can see that the surgeon will resect this narrow part and will join the other both part with end-to-end anastomosis. And this is the picture of thoracotomy. Then this is the picture of balloon valvuloplasty. In this, with the help of cardiac catheterization, a tube is passed, that is a catheter is passed at a place where the narrowing is present, and with the help of balloon, they are opening or enlarging the part. Prognosis is the mortality rate of COA after surgery is less than 5%. Okay, so mortality rate means death rate. So we can see that the prognosis is good because the death rate after surgery is less than 5%. So this was all about coarctation of aorta. I hope that you all understood. So thank you very much. Keep watching my video. Thank you.